Hello, my name is Douglas Sammer. I'm a hand surgeon here at UT Southwestern in the Plastic Surgery Department. Today I'm going to discuss an article entitled Systematic Review of Flexor Tendon Rehabilitation Protocols in Zone 2 of the Hand. The goal of this study was to evaluate different types of flexor tendon rehabilitation protocols. And in order to do this, the authors evaluated the English language literature between 1970 and 2009. The primary outcome that they looked at was the rate of flexor tendon rupture during the rehabilitation period. The authors identified almost 80 articles that address this topic. And then based upon specific inclusion and exclusion criteria, they included 15 articles in their meta-analysis. 3 of the articles that were included in the study were randomized controlled trials. Now it should be noted that none of these randomized controlled trials specifically compared the different flexor tendon protocols that are evaluated in this study. 2 of the studies that were included were prospective observational studies. The majority of the studies, however, 10 of the 15, were retrospective case series. In terms of the primary outcome parameter, the authors found that the protocol with the lowest rupture rate was the combined Kleinert-Duran protocol with a rupture rate of 2.3%. The protocol with the highest rupture rate was the Kleinert protocol with a rupture rate of 7.1%. It should be noted that none of these differences were statistically significant. So in essence, the authors did not find a significant difference in the rupture rate between the various rehabilitation protocols. Overall, this is a very well designed and well carried out systematic review of the literature. And at the time that this study was performed, there were no randomized controlled trials in the literature that compared the classic types of rehabilitation protocol for Zone 2 flexor tendon injuries. So the authors were attempting to fill a real void in the literature. It should be noted that since this study was performed, one randomized controlled trial comparing active place and hold protocol versus a passive-only protocol has been published, and the results of this study support the findings in the study that we're discussing today. There are some weaknesses to this study. I want to stress, though, that these are weaknesses that are inherent to the topic that the authors were evaluating and are inherent to the type of study that was performed and are not related to the quality or design of the study itself. However, these weaknesses do impact the conclusions of this study and are worth mentioning. For one, most of the studies included in this study were level 4 evidence, meaning that the results of this study should be considered level 4 evidence. This simply highlights the deficit in the literature on this topic and emphasizes the need for future randomized controlled trials of flexor tendon rehabilitation protocols. In addition, there was no standardization of repair types in terms of the number of core sutures or whether or not an epitendinous suture was used. Furthermore, there was a lot of variability in the rehabilitation protocols themselves. Early active motion protocols that incorporate place and hold versus early active motion protocols that incorporate composite active motion may have different outcomes as well. Overall, this was a well-designed study, and the authors were very fair in their conclusions. This study does provide some support to prefer an early active motion protocol or perhaps a combined Duran-Kleinert protocol over other flexor tendon rehabilitation protocols. The other important thing that this study does is it highlights the big gap in the literature on this topic, and it emphasizes the need for future randomized controlled trials that study the difference in outcomes between different types of flexor tendon rehabilitation protocols.